Hello, everyone. I'm a little early. I know it's not 12 o'clock yet, but I wanted to make sure everything was working just right, just fine. So, hi, Katina. Thank you for joining. And I also want to thank everyone who has subscribed to my channel. If you're new to my channel, my name is Monica Rockwell. I'm your patient advocate. I'm a patient first, and I'm a patient advocate as well. Hello, Jalicious. I'm excited about my upcoming event for so many reasons. Come Hub with Us this year is going to that next level. I'm excited that I'm going to have new presenters as well as I'm going to be presenting new information myself. And one of the things that I'm going to talk about at my event that's very important is because so many people have inboxed me, text me, messaged me, emailed me about the cure for sickle cell. And I want to share some clarity on that. And I'm going to go into more detail at my event next Saturday at the Micro Business Center. And one of the things that people don't know about the cure is the cure is the stem cell transplant or the bone marrow transplant. And the thing about that transplant is you have to first find a match. And it is recommended that if it's going to be a sibling, you and that sibling has to have the same mother and father. And you have to have healthy cells. And if it's going to be a parent that donate the stem cells, it has to be a parent that's healthy and don't have the sickle cell disease and is not recommended if they have the sickle cell trait. So I'm going to go into more detail about that. And the thing about the cure is everybody don't qualify for the cure. If it was my choice, and it is my choice, I'm 44 years old and I manage my sickle cell well. So I probably won't do the cure. And I have up until the age of 50, which means I only have 5 years to decide or to change my mind. And my match would probably be my brother that lives in Virginia. My brother JC would probably be my match because we have the same mother, the same father, and he has healthy cells. He's young and he have healthy cells. So he will probably be my match, but we haven't done any testing just yet. So, but as of right now, he is my match. And so I wanted to put that out there, but I'm going to go into more details about that at the event. Another thing that I want to talk about at the event is telemedicine. I'm excited about telemedicine because it's the cutting edge of healthcare now. And I'm a patient that have access to telemedicine. So I'm excited about that and I'm looking forward to doing more in the telehealth community. I'm also going to be talking about the Global Partnership for Telehealth conference that is in March. Matter of fact, it's in about 3 weeks. It's going to be at Lake Blackshear. I'm excited about that because I'm a conference liaison. And what that means is I'm a patient as well as a patient advocate who will do testimonials, tell my story, and talk about why telemedicine is so important to me. Telemedicine is something that is definitely needed in the sickle cell community. There are so many patients that live in rural areas where they don't have access to telehealth or they don't have access to great or adequate health care. So with telemedicine can be done two ways. If there's a medical facility in your community that can buy the equipment to have access to telehealth, that would be a great thing to have. And it also cut on travel time. If you're a patient or you know someone that's a patient, if you're in crisis, The last thing you want to hear is someone to tell you you need to drive 3 hours to Atlanta or you need to drive 4 hours to Augusta to see a sickle cell specialist. Not only a sickle cell specialist, but with sickle cell, there are a lot of complications. One of the biggest complications is having a stroke or diabetes. You don't want to ride in a car for X amount of hours to get help when you're already feeling bad. And another thing that I noticed that is big in our community now is something that a lot of people don't talk about is getting infections. One of the specialists that we see are CDC specialists. My CDC specialist was Dr. Franco, and he monitored every time I was in hospital to see if I got a infection or an infection was on the rise. So, and it's important to know that because sickle cell is a form of cancer. It's a mild form of cancer. So those that are on chemo, Hydrorid is a mild form of chemo, which is something I take every night. I take Phenergan before I take Hydrorid because the Phenergan makes sure that I'm not nauseous. So chemo breaks down the system, if that makes sense. And you want to monitor that and you want to kind of be aware of who you're around and who has access to you. And sometimes I don't go to different people home or I don't go to certain events or I don't go to certain places because my health is my priority. I can't help no one else if I'm sick myself. So I kind of monitor where I go and kind of scope out the place before I go because I have to monitor my health. Even though I go to immune therapy every Monday with Dr. Joe and he's rebuilding my immune system, which is great. I don't hear a lot of patients talking about that. Rebuilding the immune system is very important. And one of the things outside of what my doctor recommends that I do for myself is I make sure I eat vegetables. Fruits and vegetables also help with the immune system. Water helps with the immune system. And because I'm training for a walkathon, I was going to participate in a walkathon in Atlanta, but we'll see. It is my plan, but plans always change. So it's my plan to attend the Sickle Cell Foundation of Georgia marathon next month in April in Atlanta. That's one of my goals. I don't know if it's going to be possible, but we'll see. Another thing that I'm doing also is I am actually a walker for the Genesis nonprofit Iron Up run that they're preparing for in September. So I have to make sure I balance out everything. And that is so important to me and for me because in this health journey, I play a role as a patient. I need to know what my needs are as well as others. And then I'm constantly educating myself on my needs as well as the people needs that I serve. I serve the Southwest Georgia region. That is my headquartered area. It's not my only area, but is my headquartered area. Though this area is my priority, even though I serve people in Chicago, New York, Florida, um, Alabama, and other places, California. So, because sometimes people will message me and ask me questions that are not in the Southwest Georgia region, and I'm there to answer questions. And when I go to conferences, I also answer questions as a sickle cell patient as well as a patient advocate. So I'm not limited to this area, and my platform is also global. My platform is global because as a medical missionary, I reach people from all over the world reach out to me. Some of the posts you will see and some of the posts you won't see because as a patient advocate, I try to keep a lot of things confidential because as a patient myself, I want to make sure that my information doesn't get out as well. Certain things I want people to know and certain things I don't want people to know. So it's important to maintain that confidentiality. So, and plus my sister is in HR and she loved to remind me, Monica, according to the HIPAA law, you can't share people's information unless you get their permission. And sometimes people don't want their information shared. And I understand that because sometimes when people share your information, then there comes the judgment. And then sometimes people will actually make you sicker than what you really are. So that's one of the things that I hate that people do. And sometimes I'm tired. I'm not sick, I'm just tired. And sometimes it's because of the people that I'm talking to, I'm dealing with. And sometimes people make me tired. So if that make any sense, I know sometimes people ask questions because there's concern, and then some people ask questions just to be nosy. You can sign up for the telehealth conference. My goal is to also go live with it. I haven't talked to Evan to ask him if I can because he's the director of marketing. But patients can sign up. That is on Eventbrite. www.eventbrite.com. Global Partnership for Telehealth is the 10th annual conference. Yes, people can sign up. And you can sign up on Eventbrite. I'm also signed up as a vendor. I'm excited about that. I'm excited about being a vendor because it gives me the opportunity to talk about sickle cell, and it also gives me an opportunity to promote the merchandise that I have as a fundraiser. And one of the things that I want to share with everyone is that sickle cell is just not a black disease. And I know a lot of people think that it is dominant in the African American community, but it's not only in that community. And one of the things that I do want to present at my event is two things. And the word for sickle cell in Spanish is célula alciforme. That's how you say sickle cell in Spanish. I'm still working on saying it in French. That's a work in progress, but I'm going to do that. I want to show the gift bag that I have that I will be presenting at my event that will be available at my event for Latino attendees because they deal with sickle cell as well. And one of the brochures or guides that I have is in Spanish. Thank you, Sickle Cell 101, for creating this guide. Bold Lips for Sickle Cell for collaborating, and also the Sickle Cell Community Consortium. They put together this guide, and it's in Spanish, so that's wonderful for people to have to use. And in the guide, it kind of gives you what you need to maintain your sickle cell journey. You can put in there the people, your medical community, your sickle cell specialist, your primary care physician, your caregiver, your social worker. You can put all of that information in there. You can list all the medications that you're on. All of us are not on the same medications. And that's another thing. Hydra is the number one medicine that is recommended for sickle cell patients, but is not the only medicine that's available for sickle cell patients. Another thing that I have, but I don't have on me right now, is the brochure for Indari. Last year at the sickle cell symposium, my roommate was on Indari. She uses Indari. And Indari is in a powder form, so it's something that a lot of sickle cell patients add to their apple juice and make it turn into applesauce, or they add it to their morning blend when they're juicing. So that's another option. And there are other patients that are on other medications that I'm not listing because they're promoting it on their YouTube channel or their social media platform. So, which is good, is good because all of us have different stories, even though all of us have sickle cell, but all of us have different stories and all of our journeys are different. And some are younger, some are older, some are male, some are female, some are adults, some are children. Our community there is very diverse. It's very diverse. You also have whites, you have blacks, you have Latinos, you have first generation of people of African descent, you have um, people with Greek backgrounds, Turkish backgrounds. Actually, my sickle cell specialist is from Istanbul, so I'm excited about that. My nurse practitioner is from Jamaica. My um, my primary care physician, internal medicine, is Nigerian. So the medical community is very diverse, as well as the patient community is very diverse. And then the more you know, the further you go. So, and plus, I'm also enrolled in Warrior University. With that being said, we've been doing training on blood transfusions. The last two classes have been very, very informative and very educational. And the one thing that I have to do that I haven't done yet is I need to know what is my normal hemoglobin, because in the class in the webinar I know that my friend Toriana, hers stay at 11 or 12, and that's normal for her. Versus a friend of mine, his stays at 6, and he said that's normal for him. So this week when I meet with Dr. Kutler, I'm gonna find out what is my normal hemoglobin. I think it's kind of like 8 or 9. I have to go back and look at my medical records to see. So thank you for your questions. Thank you, Tina, for your question. And I'm excited about that. Thank you. And my health journey is going well. I want to make sure I balance everything. Balance is very important to me. I have to rest as well as balance. Um, I will be there at 9:30 to get started. I'm going to start it off. Mr. Ford is going to be my MC. He's my usual MC. So while he's MCing, it gives me an opportunity to rest as well as kind of talk to the people that have come and attended the event. Sherelle Bird is going to be representing Aspire Behavioral Health. There are a lot of people that were affected by Hurricane Michael last year, and there are some people that are still trying to recover. So, people that are still trying to recover, there are people that are in areas that still don't have power, still don't have cable, still don't have decent water, still don't have a lot of other things that they need. They still need tarp on their homes, or they need the tarp replaced on their home. And people need counseling. I know in our community we don't like the word counseling. So let's get rid of the word counseling and just talk. Sometimes when you're talking about what's going on and you hear yourself talking about it, it's just better. It works better. And a lot of people have lost a lot of things. Their health is still intact, but they're still rebuilding. And rebuilding process is not an easy process, but it's a process that is inevitable. So she's going to be talking about the resources that are available, and she also can provide case managers for different people. There were people in Early County that were affected. The water was high and they were flooded. Their home was flooded. Roofs came off. They were without food, without power. So, but a lot of people didn't have transportation either. People didn't have transportation to get to Albany. And that's one of the things that is not taken into consideration. You may have resources here, but it takes 30 minutes to get from Baker County, Early County, Colquitt County, Randolph County, Calhoun County, Worth County, Lee County. And I know some people in Lee County are still looking for supplies to rebuild. So Sherelle is going to be there. Her and her team is going to be there to provide those resources. Another thing that I'm going to promote is sickle cell patients are my top priority, but there are other patients that are in need as well. So LifeLink of Georgia is going to be there. Carla Hawkins is the representative for this area for LifeLink of Georgia. I'm excited about her being a presenter because Organ donation is very, 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 very important. And one of the biggest complications for sickle cell patients is organ damage, organ failure, as well as massive bone loss. So there are a lot of people that are going through dialysis that need a kidney. Got to first again, we got first got to find a match. Somebody kidney that match your kidney, and that will relieve you from going to dialysis. So you have people that are going blind, need sight, heart transplant. A lot of people need heart transplants. I have congestive heart failure, but I don't need a heart transplant. I don't have to have heart surgery or none of that. But there are people that do. So it is important to donate healthy organs that will help someone else live a healthier and a more quality life. That is very, very, very important. So organ donation is very important. And I know a lot of people overlook that when you get your driving license or your driver's license renewed, that was actually if you want to be an organ donor. And sometimes people just don't know. They don't know the importance of organ donation. And I know two people that are on a list for a kidney donation. And it's very important. I wish my college mom could come because she's the donor of a kidney. And I know one of the things that she was dealing with in the beginning was the rejection of the kidney. So that's a process as well. Sometimes it'll take and sometimes it don't. So it's important to know what works and won't and what don't works. Kidney donation is very, very, very important. Also, blood donation is very, very important. I know in the African American community, and I say that because I'm African American myself, when it comes to blood donations drive, we're not going to show up. That's just not something that we participate in because that's just not something we like to do. A lot of people of other ethnicities will donate in a heartbeat, but there are two people that I want to recognize that do blood donations that I'm proud of. My brother JC does blood donations. He talked about doing blood donations in Virginia Beach, Virginia. Courtney Peterson do blood donations. I'm thankful for him. And my best friend Travis do blood donations. I have a picture of him doing blood donations on my Sickle Cell Awareness Facebook page. I did post a picture of him doing a blood drive, and I'm thankful for him doing a donating blood. That's one of the initiatives that the sickle cell community consortium is working on. Being blood donation ambassadors. This organization out of Atlanta is working to on that initiative to take that to get more participation for that. So I'm excited about that. I've been to several blood donation events, and because of my plasma level or the my I don't pass the plasma test is what they always tell me. You don't pass the plasma test, you don't have enough plasma, you don't have enough red blood cells, you don't have we thank you for your effort, but you don't qualify. So for those that do qualify, blood donation does help this sickle cell community as well because a lot of patients, not just sickle cell patients, but patients that have surgery, they have to have blood transfusion, blood exchange, or they have to have blood donations. I know people that I'm advocating for, I won't name them, that I know one of the patients that I served, he had to have three packs of blood infused in him. So blood donation is very important. Another representative that is going to be at my event, I'm very, very, very excited about is Albany Area Primary Health Care. What's interesting about this particular representative and speaker is she was actually my enrollment specialist. It's amazing now how life becomes full circle. So some of the people that are participating in this event are people that were either my social worker, my medical professional, or they were my case manager, or they were on the other side of my health journey, and I was their client or their patient. So Miss Cindy was a person that for 2 years tried to get me Medicaid and Medicare. We worked on this for 2 years. So she's going to be there, and she's going to talk about more healthcare insurance or health insurance options. My first thing to her was, "You can talk about the sliding scale. You can talk about the sliding scale." She said, "No, no." She said, "There are more options available now. There's more than Medicaid, Medicare, and the sliding scale that will pay for healthcare services." I was like, wow. Make sure you share that with everybody, because Medicaid, Medicare, and sling slide is the only, and IPD. That's another one that I was on when I didn't have any health insurance. The IDP program, it pays for your medical, it pays for your medicine for a year. When the first year you enroll, there's a $25 enrollment fee, which isn't bad. An annual fee of $25, and you get your medicine for an entire year. But the thing about that is, they don't mail you your medicine, and you can't go to a pharmacy to get your medicine. You have to come back to the medical facility that you're enrolled in. And at that time, I was enrolled in South Albany Medical Center, where my primary care physician is and where my social worker is. So every month they would call me, "Monica, your medicine is here. Your Pro Air is here. Your sickle cell medicine is here." No, my sickle cell medicine came when Dr. Kudler and Nadine came to the sickle cell clinic in Albany or Sylvester. They would bring my sickle cell medicine, but they would bring my Pro Air. They would bring some more of my medicine. Pro Air was one of my regular. Furosemide LASIK was another medicine that they would provide. And some more, I can't think of the other medicine, but they used to give me a bag of medicine. And, "Monica, here's your medicine for the month, and everything that Dr. Ohomadika wrote out is in this bag. So thank you." So she will be there talking about that. Another thing that I want to talk about that they're going to be talking about there is going to the doctor is very important, because another thing that I've seen lately in my advocacy and going to the hospital to advocate for other patients is there has to be a record. And that's one of the things that people don't talk about. As you age, the, the first thing they're going to look for, Phoebe's going to look for, Albany area primary health care is going to look for, any medical facility is going to look for, is there a record of this patient ever being here, and have they been here before? And I'm glad that my medical team was able to pull my records from Valdosta at South Georgia Medical Center, Macon. I was at a Macon hospital years ago. They were able to pull my medical records from South Alabama Medical Center when I was in Dothan. I was hospitalized there for a week. And Phoebe, of course. And there's one more place that have up there, one stop in Warner Robins also have medical records on me. So I'm glad that all of these places have medical records on me. And then there were a couple of convenient stops, med stop places that I visited while I was in Valdosta. Convenient care is what they're called. Valdosta, Dothan, Warner Robins, Macon, a couple of convenient cares I went to that had my medical record. So I'm glad that there was a paper trail, so doctors can kind of know what works and what don't work. And also, I don't have my medical bracelet on me now, but I usually have my medical bracelet, because my medical bracelet it has a list of all the things that I'm allergic to. That's very important as well. Knowing what you're allergic to. I'm allergic to hydromorphone. I'm allergic to aspirin. I'm allergic to penicillin. I'm allergic to Novocaine. So it's important that your medical community knows that as well. What you're allergic to, what works and what don't work. So gabapentin don't work for me, but amitriptyline does. So that's another thing that people need to see and need to know. Um, she's going to be talking about that. And also, Albany Area Primary Healthcare also have telemedicine. It's not a service that is promoted, or there's not any. I haven't seen any marketing or commercials for it, but I know Miss Cindy said, yeah, that we do provide telehealth. I know that telehealth is also provided to stroke patients, which is good because I won't name any names, but I do know some patients that receive telemedicine because they are stroke patients, which is great. So that's going to be good as well. And telehealth give you access to medical professionals around the world. World class medicine comes to you. In 2019, you can have the best healthcare, or you can have access to the best specialists in the world. Thank God for telemedicine, telehealth, e-medicine. Some people call it e-medicine. So, and then your prescription can be sent via email or based on a website. Another thing that I'm probably going to share with people at the conference, I'm not going to log on to it, but it's something that I'm going to show people that I have that is great for if you're a person that travels. I'm a person that travels. And one of the things that I want to talk about is well, it shows my name, but it doesn't show my work. Let me go back to the actual app. I want to, because I'm not going to show my medical records. Okay, it's not letting me in. I forgot what my password is. Okay, it's showing up. One of the things, well, it doesn't show anything, which is good, is the Helio app. It's an app. Well, it's not showing good on here, but it's an app that I have on my phone that is right here. It's that app that's right there. I don't know if you can see. It's that app right there for my medical records from my primary care physician. Albany Area Primary Healthcare has that app for patients. So if you need updated information on the last time I seen Dr. O, or last time I seen Dr. I can't pronounce his name. My other specialist there, or my social worker, all of that is in that app, and the medications that I'm on. So I don't have to walk around with a list of stuff because I have this app as well. So it's wonderful to have, especially when you're traveling. You don't have to have extra paperwork. Jalicious, you have it. It is thebomb.com. It is very helpful when you're traveling. So, and if a person you're near needs that information, all you got to do is pass them your phone. Here's my information. And one of the blessings that I have that I'm always grateful for. I don't think I say it enough. I am grateful for the medical professionals that are in my family. OMG. I have a lot of people in my family that are in the medical field. So, and then the ones that I travel with knows me. So that's always a plus. So when I'm looking a certain way, I'm feeling a certain way, they're like, "No, Monica, we see what you looking like, and we need you to chill out. We need you to go sit down." So that's good. And Eunice, even though she says she don't work when she's on vacation, she's still a nurse. My cousin Eunice is a registered nurse, and so she'll be like, "Monica, you need to do this. If your pressure is dropping, you need to do this. If you need to drink more water, you need to do this." And if Sheila's another person, "Monica, I need you to sit down and rest. I'm looking at you." Or like when we were in California, and my head, I wanted to go to the parade in downtown San Diego, but my body said not today, not today. So my cousin Sheila was like, "Monica, we're gonna come back for you at lunchtime. Just be ready for lunchtime." So I'm thankful for that. And my sisters also know, and my parents know, when like, "Monica, you need to go somewhere and sit down. You don't look the best." I also have friends that do the same thing as well. And that's a blessing. That's a blessing because I love to travel, and I have people around me that know medical terms, or they know me, or they know what needs to be done. So that's a blessing in itself. I don't say enough. I don't say it enough. I don't say it enough, but I am blessed. I know my doctor says it a lot too, Dr. Dickey. Like, you are a very, very, very blessed woman. You have access to resources that other people don't. And I know my sister, my younger sister, brought that up to me last year at my last hub event. She was like, Monica, everybody don't have access to their physician. They don't have access to their primary care physician, internal medicine physician. So you're very blessed. I'm very blessed and I'm thankful. Every opportunity I get, I'll thank my team. Thank you, Dr. Dickey, because you don't have to do this, but because you said yes that you would speak at my Come Hub event, I'm thankful. My social worker, God rest her soul, I'm thankful for Miss Vicky. Miss Vicky opened up a lot of doors for me, and I'm thankful. I'm not gonna cry because she's in a better place, but Miss Vicky opened up so many doors for me, and I'm thankful. I'm also thankful that my sister Jennifer recorded last year hub event. I was able to download it, and some days when I'm in a place where I'm not feeling my best and I just need to be encouraged, I sit and I watch that video. I sit and watch that video because Dr. Deacon said, Monica, thank you. That meant a lot to me. And as I'm constantly networking, I'm always networking. And as I was talking to a team member, I won't name her name. I was talking to a representative from Albany area primary health care. And I went into a meeting a couple of months ago before this event, and it was interesting how they were having a conversation about me. I won't name the people that were having this conversation, and they were like, "We've been trying to figure out where did SWGA sickle cell awareness come from? How did she get on the circuit? What she just come from nowhere?" And it was a closed door meeting, and I sat and talked with the young ladies there, and one of the young ladies was a mentor to my social worker. I said, I'm gonna try to do this, and I'm gonna try to do this without crying because I still cry. I said, actually, what put me in the circle was my social worker. She went from Miss Vicky went from being I tell this story all the time. My Miss Vicky went from being my social worker to my mentor. And one of the things that she talked about a lot before she transitioned was she said, Monica, everywhere I am, there's going to be material on sickle cell. She said, you are the representation for sickle cell, and sickle cell is gonna be in every Albany area primary health care facility. It's going to be everywhere I am. So she opened up a door where I was a vendor for the Hope Run last year, and that opened up the door to me being a part of the telehealth community. I met the manager for this area, Mr. Ed Honeycutt. He was the account manager. I had an opportunity to get his business card, and he set up a meeting with me at Elements Coffee, and he said, when you walked in the door, I knew who you was. Before I even looked at your sickle cell shirt, I knew who you were. And he said, Monica, he said, you stirred up something. So Phoebe's working on getting telehealth for sickle cell patients. I said, "You know what, Ed Honeycutt, I didn't think I was doing that much. I guess because I didn't see the fruits of my labor." He said, "Monica," he said, "you stirred up something." He said, "Because I got to meet with this guy. I don't know who he is, but his name is Dr. Cooler." I said, "That is my sickle cell specialist, and I pass your information on to him." I said, and that was one of the most rewarding things in my advocacy work. He said, and but we're gonna set up telehealth for sickle cell patients in Worth County. And I said, thank you, Phoebe Worth. I said, thank you. I said it is definitely needed. I said because even though I'm not feeling my best, when I'm going through a pain crisis, or I'm going through sickle cell crisis, or I'm having a migraine headache, I want to see Dr. Abdullah Kudlar, or I want to see nurse practitioner Nadine Barrett, because I know they know me. And they know when I'm feeling my best and they know when I'm feeling my worst. And a lot of things I just don't have to say because they know. And I know Nadine said one of her ways of knowing when I'm feeling my best or not feeling my best. She'd be like, Monica, I ain't got no YouTube video from you. I haven't seen any emails from you. I ain't got no call from you. So I know something is going on. So, and she'll be like, Monica, we know something going on. And she already knew. She said, you having migraines again? I said, I am. That's why I haven't been doing any videos. I haven't been doing anything. So she was like, we're gonna get you your medicine. I've already sent it over to your pharmacy. So you go ahead, you get you some rest. And another thing that they'll do, I'll get a phone call from my team is Monica, I know you're going to a conference. We know they have classes all day because we go to conferences ourselves. But what I need for you to do is look at that agenda, look at those class schedules, and I need you to pick two things or one a day and rest. I want to make sure you don't go into crisis. I want to make sure you don't get sick. And sometimes I do 3 to 4 classes, but I'm okay. And sometimes I take break between the different classes and the different seminars. And that's a blessing. So when they said telehealth and it was either December or January, I can't remember which one it was, but Mr. Ed Honeycutt said, Monica, it's live. Your telemedicine at Worth County is live. So you can go there and check it out, do whatever you need to do. And I said, thank you. Thank you. And telemedicine is also a making for sickle cell patients at Navient Care. It's one of the medical, it's not the Coliseum, it's the other hospital that's in Macon that gives telemedicine access for sickle cell patients. I have to go back and look at the name, but I have the name, I just don't have it before me right now. So I'm thankful for that. She also opened the door for me to every time Albany Area Primary Health Care has some kind of health fair, I'm a vendor. And I'm thankful for that. They're a vendor for me and I'm a vendor for them. So my social worker, thank you. Thank you. And it's a blessing because it gives me more exposure, it gives me more access and networking. And one of the things that I did for her is it was to me, it was more about her than anything else, is the event that I did in Early County. And I remember before the event was we had National Health Care Week, National Health Care Center Week, and she said, Monica, I've already put you on the schedule. You're gonna be at Terrell County Medical Center, no, Dawson Medical Center. So I was there providing information on sickle cell, and people were. I had a table where people asked me questions about sickle cell. Of course, South Albany Medical Center. I was set up there to talk about sickle cell, provide information for people, and I didn't get to go to Americas. I wouldn't. I had to call Miss Cable because I wasn't feeling my best, so I didn't make it to that health fair. And I told her to charge it to my head, not my heart. My body just, no, you're not going to America. So, but Miss Vicky did set up for me to go down there and share information with the people of America, Sumter County Medical Center there. But I wasn't able to do that. So, but I'm still out there. But the Let's Game Plan for sickle cell, Miss Vicky, when I was at the South Albany Health Fair, South Albany Medical Center Health Fair, she said, I'm looking at you and I need you to do something for me. She said, I need for you to be well and I need for you to show up and show out in Early County. I was like, yes, ma'am. She said, I don't need you sick. I don't need you in the hospital for the Let's Game Plan event because you coming to my hometown and I want you to show up and I want you to show out. So when I went to America, when I went to Early County Blakely, I did an ad in the paper. She said I brought her back the ad, and she was like, "You own it, girl, you own it." I said, "There's promotional for this event in the Early County News as well as the Dothan Eagle." I knew about the Dothan Eagle because I lived in Dothan for some years, so I already knew the publication. So I put the event in there, and they promoted it for me. I'm thankful for Dothan and my connection in Dothan, and I think it was a week before the event, Miss Greta gave me a call and then she messaged me. She said, Monica, She said Miss Vicky has passed away. My heart was broken. That was hard for me, but because I believe in character and integrity. That's the word for 2019 for me. Character and integrity. Your character and your integrity, it determines a lot. People will tell you a lot about themselves, but I watch your character and I watch your integrity. Character, integrity, and integrity is what you do when nobody's watching you and you do the right thing anyway. And I said that to say this. Even though Miss Vicky wasn't gonna be at Let's Game Plan for Sickle Cell, I showed up because I made her a promise and I made Mr. Ford a promise. I said, Mr. Ford, the first event I held in Shell Park, I said, if you would speak for me, I said, whatever you require of me, I can't pay you, but whatever you require of me, I'm gonna do it. That's my I'm gonna pay you back. He said, Monica, you don't have to pay me back. But what I want you to do is bring this event to Blakely. I said, I got you. I said, I got you. So even though it happened 2 years later, I still kept my word. I told him in 2016, I said, I'm going to do an event for sickle cell in Blakely. And I did because my character and my integrity, even though he didn't bring it up again and I didn't bring it up again, in my heart, I knew what I promised. And your word is your bond. So I showed up in Blakely and I showed out because that's what my social worker wanted. And Greta called me again. She said, Monica, she said, Miss Vicky, I know she made an agreement with you and you told her that you would do the Albany Health Fair. Albany Community Health Fair with AAPHC. She said, she's gone, so Monica, you don't have to do it. I said, Greta, let me tell you something. I said, even though Miss Vicky is gone, I made her a promise. I said, Miss Vicky, I'm going to be there and I'm going to keep my word. So it wasn't about Miss Vicky, it's about my character and it was about my integrity. So even though it was 97 degrees outside, and I remember Miss Vicky saying that, she said, Monica, she said, you don't have to stay the whole time because you have sickle cell. I said, Miss Vicky, I'm gonna stay as long as I could. It was hot out there, but I stayed there because I told her I would. My character says I'm gonna do it in my integrity, even though she had transitioned out. But I told her I was gonna do it, so I did it. And one of the rewarding things about being at that event was how they honored her. I didn't know she started the community health fair. That was a wow. And I was like, that was my mentor. That's what she do. And they talked about how she served and she served and she served and she did. And I remember Miss Vicky coming up to her a couple of times and she was like, Monica, she said, you tell me what you need and I'm gonna make sure you have it. And I was like, Miss Vicky, they said I need an oxygen tank, and they wanted $500. I don't have $500. I'm unemployed. I ain't even getting disability. She said, I got you. So she wrote up the paperwork where MRS, home health care, provided my oxygen tank. She said, you give them what you can. If it's $10, you give them $10. She said, but you're gonna get Medicaid and the Medicare, and I'm gonna make sure you get that. So I end up getting that. And she said, anything else you need, I still have that because it's sentimental. I think it was 2014. I have the thing that Miss Vicky gave me. For some reason that year, it was either 2014 or 2015. I want to say it was 2015. And she called me. She said, Monica, you're the winner. I said, Miss Vicky, I'm the winner of what? She said, we pulled names and you're the winner of a gift box. And I said, okay. She said, come down to South Albany Medical Center. She said, I don't know what you're going through, but it was on my heart to give you this gift box. I got rid of the box, but I still have the label that was on the box. She said, I know you haven't been approved for Medicaid and Medicare. She said, but we at South Albany Medical Center wanted to do something for you. So in this box, my mom drove me to get the box. And in this box was a turkey, was bread. Um, it was like a care package. And she said, and my mom was like, everything in this box is what we needed. I think it was like cornmeal and a flour in there. I know there were a lot of canned goods. And she said, I know you haven't been approved, so we at South Albany Medical Center and Dr. Ohamadike want to give you this care package. And I'm thankful for that. And I was like, wow, thank you. My mama was funny. She was like, everything in there we need. I was just thinking about Mom. It's the holidays and we ain't got no turkey. So that turkey, a butterball turkey. No, she gave me the certificate to go to Harvest or Walmart to get the turkey, but the other stuff was in the box. And I think I still have that envelope. I have to look in my treasure chest. And I said, thank you, Miss Vicky. Thank you. And I remember talking to some of her coworkers, some of her peers, and I remember them saying, she don't speak for people. I said, when I first asked Miss Vicky to speak at my Come Hub with this event, she told me, Monica, I don't do public speaking. And I said, Miss Vicky, I said, you're the best social worker in the world. I said, but if you don't speak, will you do something for me? She said, sure. I said, will you send another social worker to speak? She said, okay. I think the girl name was Shakina. Shakina Reeves, I think is the girl name. She said, I'm gonna get her to do it because I don't do public speaking. I don't do. I said, Miss Vicky, that's fine. I said, but if the audience have questions, I said, wherever you're sitting at, I'm just gonna come over there and let you answer the questions that the people might have. She's like, okay, I can do that. I can do that. I said, thank you, Miss Vicky. I said, because I want to share with the world my social worker and my medical team. And she said, okay. She said, okay. I said, thank you. Thank you. And she said, but she got you. She gonna do it for you. But when I showed up there that day, the day of the Come Hub with us last year, Miss Vicky walked to the podium and she said, I'm not gonna do as good as Dr. O. His name is Dr. Home Dick, but everybody call him Dr. O. She said, but I'm gonna do what I can. And just the fact that she stood up there and did it meant the world to me. It meant the world to me. Because everybody's like, Miss Vicky don't speak, Miss Vicky don't speak, Miss Vicky don't speak. But I actually have Miss Vicky on recording where she actually spoke at the Come Up With Us event. And I'm thankful. Again, I'm thankful. I thank God for her. I thank God for her standing there and providing the the sliding scale application for the people that didn't have health insurance but needed health care services. So thank you again, Miss Vicky. Thank you. And my health journey is going pretty well. I know that was one of the things that I said I was going to talk about. I have 7 minutes left before this video ends, this live streaming ends. And I want to thank my sisters and my family. That's something I don't think I do enough of. I have the world's best sisters. My sisters, Jennifer and Tina, they are the bomb.com. Tina's always at my registration table between her and Jennifer. That I'm thankful for that. Jennifer's my videographer, photographer, so I'm thankful for that. And they do better photography than the people that are licensed to do photography. So that's a blessing within itself. I'm thankful for them. I'm thankful for my mom and my dad. My mom and my dad do a lot. They do a lot. And my mom do a lot. My mom is my caregiver, so she does a lot. And I thank her every opportunity I get, and I bless her every opportunity I get as well. Sometimes lunch is on me, Mom. Today, lunch is on me, and some days I try to stick something on her stove so she don't cook today. Mommy, you going out to eat, I know Dad ain't gonna go, so we're gonna bring Dad something back. So I know my mom like to go to Golden Corral now. And every now and then we'll go to Blackbeard. My mom loved their fish at Blackbeard. So Mom, today I'm gonna take you to Blackbeard. Let's go to Blackbeard. So we would go there, and sometimes she liked to eat at the hospitals. Sometimes they have good food. Phoebe Worth have nice food. Their food is delicious. So we'll go there, and I'm like, Mom, lunch is on me. You drove, so lunch is on me. And some days I'll put gas in the car. I'll put gas in my mom's truck, or I'm like, Mom, my gas is on me, breakfast is on me, lunch is on me, dinner is on me. And it also gives my mom an opportunity to minister to people. That's like one of my favorite things to see. That's her service. And most people remember me as, you're the girl whose mom is always with her. Yes, I'm that girl. I'm blessed to have my parents. Both of my parents are still living. So I'm blessed to have my parents with me. And sometimes my extended family will go to doctor's appointments with me. And one year, I think it wasn't last year, the year before last, yeah, my aunt Cynthia was at the sickle cell clinic because she had to deliver a sickle cell patient to his appointment. So that was a blessing. My aunt being there, and sometimes my aunts go to me with my doctor's appointment just so they can hang out with their sister, and I'm okay with that. And sometimes my uncles will go with me to my doctor's appointments with me. And sometimes when my family from Florida come, they'll go to my doctor's appointments with me. And sometimes I don't photograph that because those are private moments to me. And then I don't want my aunts and uncles to say, girl, you better not put me on Facebook. So I don't, sometimes I do take pictures, but they're in my private collection. I don't post them. They're in my, either in my phone, they're on my iPad, or they're on my laptop. So they're photographs that I do have. And there's sometimes something I look at sometimes when I'm not feeling my best and just need that word of encouragement, or that moment of love. Because I know my family and friends love me, but sometimes I just need that alone time to reflect on it, to reflect on that, and to reflect on my godmother. My godmother give a lot of inspiring talks to me, and I have the best godmother in the world. She give a lot of godly advice. She don't give worldly advice. When she give advice, you better believe it's somewhere in that Bible, and it's going to inspire, and it's going to take me to that next level. And I can hear her saying that because I'm a very audio person. She'll say that a lot. Monica, don't focus on who don't like you. You focus on who love you, and you focus on what God is doing in your life. Everybody's not going to see what God is doing in your life, and everybody's not going to understand what God is doing in your life, but you do it anyway because it's pleasing to Him. And that's a blessing to have my godmother. She don't do the social media thing, and I try not to post too much, but she's an awesome community leader. So I do want to share her with that. Another person I want to thank that's been supporting me in my advocacy is my Aunt Carol. My Auntie Carol, Miss Mabel. I want to say thank you to all of those people who support me. There's not a day or an event that don't go by where I don't say thank you, because they don't have to do it. People don't have to do nothing, but because they do, thank you. And I'm thankful for the people that support me on social media. A lot of them don't comment, they don't like, they don't share, and I'm okay with that. Long as you see my work, I'm okay. Because it helps the algorithms so they can see that there are views. I have 25 subscribers, and again, as I close out, I want to say thank you, thank you, thank you to my subscribers. And I also, before I close out, I want to say a special thank you to another one of my drivers who's not family, but he does a lot. And he was very instrumental in Hurricane Michael, and because his backup generator made the difference in me and my father's life, and that is Sean, my friend Sean, longtime friend. He provided the backup the generator from Sean H. Pressure Point. He do a lot of driving for me, so I also want to say thank you to him as well. He does a lot. And he also subscribed to this channel, so thank you. I don't think I say thank you enough. And I want to thank you for the media as well. Carla Heath Sands, Dr. Wendy Wilson. Um, there's some more people that are in the media, and Miss Diane Craft at WALB. Make sure that my stuff gets in. And I've seen that Come Hub with Us is in the community event, so I'm excited about that. And one more person, Chris Rapley and Stacy Farrell of Rapco. The video you did for this event was phenomenal, and I love it. And as I close out again, I know I sound like a Baptist preacher, but one more thing I want to add to my giveaway. Stacy Farrell of Cincy, charge it to my head, not my heart. I don't think I pronounced that right. Cincy is going to do a basket giveaway. And as the attendees are coming in, you're going to be given a ticket, and whoever name is pulled out of the basket will be in the raffle will win a gift basket from her, a gift basket from me, and gift bags will also be provided by CareSource. Thank you, CareSource. Thank you, Ms. Sharon Peoples, for providing the gift bags for Come Hub with Us 2019. And I will see everyone next week at the Microbensis Center at the conference room downstairs, 230 South Jackson Street, Albany, Georgia, 31701. And thank you. We'll see you soon. Any questions, make sure you email me at monica.rockwell@gmail.com. I'm not going to put up my phone number because I get telemarketers call me all the time. So you come out better emailing me or inboxing me. Until next week, I will only hold you for 2 hours from 9:30 a.m. until 11:30 a.m. Come hub with us, your patient advocate, Monica Rockwell. Goodbye.